And we're back to wrap up tonight's Catholic Idaho with our friend Brad Hahn. He is the CEO and Secretary of Solidarity HealthShare. He's an Arizona family man and an attorney who founded Solidarity along with Chris Faddis. His deep commitment to the Catholic faith guides Solidarity HealthShare's values. He's a member of the Arizona Bar, Canon Law Society of America, Catholic Medical Association, and an allied attorney for Alliance Defending Freedom. Welcome back to the show, Brad.
Yes, thank you, Brian.
Back in mid-August, the Wall Street Journal featured an article, "What Does Knee Surgery Really Cost? Few Know, and That's a Problem for Health Spending." And of course, we've been talking about that for many months here on this show, but share with our listeners tonight kind of a summary from that article.
Yeah, I think that's a huge moral issue with health insurance right now, because no one knows what healthcare costs, a procedure costs, from the consumer, from the provider, nor do the insurance company. So that article in the Wall Street Journal highlighted these issues and basically said there was a small, and it's a pretty large hospital system in La Crosse, Wisconsin. For the last many years, they've been charging $50,000 for a knee replacement surgery. And so somebody finally asked the question, how much does this really cost us? How much money do we have into this procedure? And they realized that they only spent about $10,000 on such a procedure. So for the last about 5 or 6 years, they've been overbilling this procedure by $40,000, and people have been paying it. And that is in line with what our experience is with Solidarity HealthShare is. We're seeing that a lot, where people don't know what things cost, nor do the provider. And that's what we do on behalf of our memberships at Solidarity, or for our members. We actually go through and try to vet and determine what fair and reasonable pricing is for a procedure in their area.
So basically, the healthcare system here in the U.S. is broken?
Well, it seems to be. Yeah, it's because we consume about the same amount of healthcare in this country as other first world countries, but we pay about 3 times more for it. And I think a lot of this is just the free market's not allowed to bear its its great checks and balances. And so that's what we do at Solidarity, is really get in there and really help and fight on behalf of the member to get fair and reasonable pricing. So this year so far, we've averaged about a 65% discount in our members' medical bills.
So has the situation only gotten worse since the passage of the so-called Affordable Care Act?
Yeah, it seems to be. Yeah, and what's happening with the Affordable Care Act is it's still an out-of-control pricing system, so people don't know what things cost. But number two, what the big issue is, the consumers are so disengaged from the actual determination of what price is. So I'll give you an example. So like when my son had to get an ankle MRI done, we called around. The average cost was about $250 to $2,500 for the same procedure, for the same imaging. And to me, it's just things are completely out of control, and that's why we have to fight for best prices. And if you kind of have two alternatives here, Brian, you can either ignore and stick your head in the sand like we're doing right now with healthcare, and let the insurance companies keep raising your rates because there's no checks and balances what these bills are. Or you can join a health sharing ministry like Solidarity HealthShare, where we help fight fair and reasonable pricing on your behalf.
We're talking with Brad Hahn, CEO of Solidarity HealthShare, tonight on Catholic Idaho, and it sounds to me like both the doctors and the patients are frustrated. They probably feel powerless to change anything, but how is health sharing different?
Yeah, the big thing with health sharing is, we're not insurance, number one, but number two is we just ask the providers to submit a fair and reasonable bill, for the services they contract with. So example, we had a bill that had $200 for a mucus collection device, which was basically a box of tissues. So something like that we vet and we reject. And so that's where we're getting a lot of support from providers right now, because they're saying, you mean I can just submit a fair and reasonable bill and you're going to try to get me paid in 30 days? And that's our goal. And so that's where we're getting a lot of providers rallying behind us as well, and really want to work with us.
So it almost sounds too good to be true. How does this work? How are you able to do these tremendous cost-cutting savings?
Well, just like IT and technology is in every area of our lives, and it's the same with healthcare as well. And so there's some great programs out there that we have that we entrust our billing processes to. And so we can actually take a bill. I'm sitting in Washington, D.C. right now, ready to go on at Capitol Hill tomorrow. But what we can do is we can go, if I had to go to an urgent care right now, is we can take that bill and vet it for fair and reasonable pricing for Washington, D.C. area, which may be a different pricing structure than it would be in Boise or in Phoenix. And so that's what's a blessing with technology. So that's what our goal at Solidarity is, how we take the best practices for cash pay pricing, self-pay patients, and we try to use that technology to help our members.
And of course, being Catholics, we do want to protect our conscience. So share with our listeners who maybe don't know about that through Solidarity why that is important for a Catholic consumer.
Yeah, that's the big issue is, we as a Catholic, we try to, do good and avoid evil. And especially when it comes to paying for our medical care. And that's what the Affordable Care Act did, is it forced, everyone in the United States to pay for contraception, sterilization, abortion, and abortion-inducing drugs. Well, that to me, that's a material cooperation in amoral and evil acts, and my family refused to participate in that. And so that's why we founded Solidarity HealthShare, because our member guidelines, which dictate what items are eligible for sharing, there's nothing in there that compromises our conscience, a well-formed conscience, I should say, because our member guidelines are follow the teachings of the Catholic Church.
People are always afraid of the unknown, Brad, as you well know. People are people, so they're used to being customers of insurance and not members of a health-sharing membership. Maybe explain the difference.
Yeah, that's usually the biggest hurdle we find, is because everybody in this country is inculcated and taught that, you have health insurance. So it's kind of a huge paradigm shift when you say, well, here's what we do at Solidarity is, we get fair and reasonable pricing on behalf of our membership, and then Solidarity, on behalf of the members, we facilitate the payment of those medical expenses among our membership. And so I'll give you an example. When my son had ankle surgery this year, it was more than my $449 per month contribution to Solidarity. And so other members were able to kick into my share box to make sure that these providers get paid. And that's something we're constantly monitoring, because our whole goal of health sharing ministry is to get that number right, that monthly contribution right. So for every dollar that comes in that's eligible for health sharing and sharing a member's medical expenses, it goes out for that purpose. And so we're constantly monitoring that, making adjustments on our sharing power, so to speak.
So you mentioned you're on Capitol Hill. So after you get all prepared today, what are you ready to do tomorrow? What are you going to unleash upon our nation's leaders?
Yeah, I'm meeting with some key people at the Health and Human Services, just to make sure that they understand from our perspective why conscious protection is so important, and why health sharing ministries in particular, like Solidarity, is so vital, not only to protect the conscience of our members, but also a free place to exercise our religion, and also too is a great place where we can really do some great things for our members. And so that's just staying in front, ahead of the politicians and all the political games that we see in this country.
Been talking with Brad Hahn, CEO of Solidarity HealthShare, tonight on Catholic Idaho. Brad, if there's somebody out there interested in learning more, where do they go, or who do they call?
Yeah, they can reach us online at solidarityhealthshare.org. That's solidarityhealthshare.org. Or they can call us at 844-313-4999. That's 844-313-4999.
Best of luck in D.C., and we will talk to you again next week.
Yes, thank you, Brian.
All right, thanks, Brad.